Namaste. I am Dr. Veenu Agarwal. I am an obstetrician and gynecologist with Cloudnine Hospital, Golf Course Road. DNC is most commonly used for medical termination of pregnancy or for evacuation of the uterus after miscarriage. In some cases, however, it is also used for gynae problems. This can be in conditions where you have very heavy bleeding or abnormal uterine bleeding. Sometimes there may be polyps that need to be removed and DNC is done along with that. In women who have postmenopausal bleeding, DNC is also done for them. If there is an intrauterine device whose thread is lost, we do DNC in such cases also. Apart from that, we do DNC sometimes to rule out a malignancy. Now, what are the risks and complications for DNC? DNC is a very commonly done and very safe procedure. In some cases, there may be bleeding during the procedure, which is mostly controlled using the uterotonics. Sometimes the cervix may be injured, which can rarely, in later on, cause cervical incompetence at the time of your pregnancy. Sometimes, if the check is not done properly, you may have incomplete emptying of the uterus. Very rarely, there may be perforation of the uterus or a hole in the uterus while doing the procedure. Mostly it gets better on its own. We keep you under observation for some times, but sometimes we may have to do a laparoscopy for that. If antibiotic cover has not been given properly, you may develop some pelvic infection also. DNC, as it's a very common and safe procedure, most studies have not found any association with infertility in future, or there is no association with having any complications during future pregnancy. A very rare risk is forming adhesions inside the uterine cavity called the Asherman syndrome. It can be easily treated using a hysteroscope or a long tube with a camera which is inserted inside the uterus, and all the adhesions or the fibrous scar is cut, and you can conceive naturally after that.